Today I want to talk about how I went remote in nursing and how I landed my CDI job. Hey guys, it's Noreen and thank you for making it to my channel. Today I want to talk about how I went remote in nursing and how I landed my CDI job. So most of you guys know, or some of you are new here, I have been a nurse for 10 years. Primarily I worked in the ICU a little bit after COVID, well during COVID, after COVID, yeah. After COVID, I was burnt out. I no longer wanted to do ICU, so I transitioned. I went to PACU. I will talk about that in another video, my transition to PACU. And so I did PACU for a little bit, but I still wasn't happy. I mean, you're still in the hospital, still kind of bedside. It's better than actual bedside, but this is not what I wanted. Realistically speaking, I wanted to be remote. And so I did my research. So the thing is, after COVID, so after COVID is when I started looking for remote jobs, but I wasn't successful. I kept getting rejections. So I stopped, but I regret that. I should have kept going. I don't think I should have stopped. I could have kept going and I would have been landed a remote position. But yeah, so we're working in PACU. I was trying to get a remote position. And then I learned about CDI. I know there's a couple different jobs, so there's utilization review, concurrent nurse review, clinical nurse review, case management, telehealth RN. There's just so many options out there. If you guys are interested in learning more about those, make sure you guys check my Beyond the Bedside PDF. I did put that together for nurses who are interested in going remote and want to learn about the different positions, because depending on what you like will help determine what's for you. I also do have a remote nurse starter kit. But yeah, so then I learned about the CDI, clinical documentation. I had a friend who was also doing CDI. She was new to it as well, so that helped me kind of gain some understanding on it. And so I decided to apply for this position. So honestly speaking, realistically speaking, I was applying for everything. I was applying for clinical nurse review, concurrent nurse review, utilization review, every position possible I was trying to apply for, okay? And so I landed on the CDI. And so what worked for me was that I was already working for my hospital PRN, and so I saw the position open for the clinical documentation specialist, so I applied for that. So that's why I recommend, if you guys are already working for a facility, the best option honestly is to transfer within your facility. I think that's literally the best option. Or of course you can go for a local facility. You guys can check Indeed, LinkedIn, all that good stuff, but I think what works best is applying directly on the website. So if you're on Indeed and you see that they are posting a position, go to the actual website and apply there. You definitely want to apply as soon as possible. So yes, that's how I landed the role. And so what CDI is you're basically going through the chart. You're reading doctor's notes, interdisciplinary notes like your consults, PT, OT, speech language pathologist, all these people's notes. You're making sure that the diagnosis and the treatment matches the patient's clinical picture. So if this patient's getting treated with calcium, but nobody said hypocalcemia, you will send a query, which is like a verification to say, hey, does this patient have hypocalcemia? I see they got calcium and then their calcium was also low. So that's a simple example, but it gets more complex. You have to connect things like if a patient came in with a subdural hematoma or a hemorrhage and they were already on aspirin and Plavix, then you can send a query of cause and effect, like was the subdural hemorrhage enhanced or due to the aspirin and Plavix, so things like that. And it just gets more complex. If you guys are interested in learning about CDI, I do have CDI kits that I put together for you guys. These are resources that I put a lot of time in, and these are resources that I myself wish I had when I was starting off. So yes, definitely utilize those. And then you can also check out the remote nurse kit as well. So that's pretty much how I got that position, was just the internal transfer. And then, like I said, you're going through the chart, ensuring that the patient's visit and their treatment diagnosis is represented that way. It helps the hospital get reimbursed properly. Like if a doctor says a patient has sepsis, they didn't really have sepsis, there was no fever, no infection, it's your job to rule that out. Again, the thing is you want to make sure the hospital is being reimbursed properly, right? And it's very big on accuracy and integrity. That's why it's clinical documentation integrity or specialist. And so typically my day is, so how my facility does it is we have 3M, which is now called Solventum. You're on that. And then we also use Epic. So you're going through the Epic chart as well as the Solventum chart. We have a template where you're going through the H&P, writing down vitals, labs, BMI super big, going through consult notes, diagnostics, progress notes, treatment, notes to self, things like that. And then when you're going through your queries, you definitely want to emphasize and prioritize your risk factors, your signs and symptoms, and treatment and monitoring, things like that. And so basically what your day is like is you're going through your answered queries, you're going through your new cases, you're going through your re-reviews. It's definitely a lot to learn, but it's definitely rewarding. It's definitely worth it. I definitely recommend it if it's something that you guys are interested in doing. I would definitely say to check out my resources. What you can also do is, I know like Actis, I think, has like a boot camp which you can knock out in a weekend. It'll give you like a little certification, and it's like an apprenticeship, and it will help you understand more of what CDI is. But I think I give a pretty good breakdown of what it is, and I'm actually going through it now. So everything is fresh. And then that's the thing too, like my resources and stuff are resources that I actually use for myself, and then I just put them together for you guys to use them. So I definitely recommend that. So if you are interested in transitioning, maybe it's not CDI, maybe you want to explore one of those other options that I gave you, you should definitely check it out. Make sure you guys check out my PDF, the Beyond the Bedside, because they do have other options for remote nurses. I definitely feel like there's just a lack of awareness when it comes to this stuff, especially in the nursing community. So that's why I'm very happy to like help be a resource for nurses so that they can help go remote. So yes, if you guys enjoyed this video, make sure you guys comment, like, or subscribe. If you guys found this video helpful, make sure you guys comment, like, and subscribe, and let me know what more you would like to know and what you would like to see. Thank you.